Excellent. Well, welcome to our conversation with veteran ASXL parents, the Richards family, and Lori Verlinghieri, who are going to share about transitions of care from childhood into adulthood. So I'm going to let them introduce themselves, and then they're going to share some of their learnings from their experiences with their own kids. So why don't we let Melissa and Andy start first?
Hi, I'm Melissa Richards. I'm mom of Jaden. She is 21 years old and has Bowring-Opitz syndrome, ASXL1.
Hi, I'm Andy Richards, dad, all of that.
Hi, I'm Lori Verlinghieri. My son Jacob is 21 and he also has BOS.
So maybe Melissa and Andy, if you could just sort of share a little bit about maybe your high level concerns as Jaden transitioned from pediatric care to adult care. What was the most concerning and challenging for you? What were you most anxious about as you faced that transition? And what have you found has been helpful to know now that you're on the other side, or maybe in process of being on the other side?
Yeah, sure. I'll kick it off and then Andy, you can elaborate. For us, we've been really lucky that Jaden, her overall health has been strong. We have, touch wood, have not seen a lot of hospitalizations now that she's older and stronger. We did face that when she was really young. So for us, the biggest, I'd say, obstacle and sort of fear was that transition out of school. So here we live in New York State. She was a part of the public special needs school program called BOCES, and you age out at 21. And it really does feel like you wake up the next day and all of the services are gone. She was having all of her therapies at school, including the fun ones like music therapy. And she's very, even though she's nonverbal, she's very social. She loves being around other kids. And so we were nervous about her leaving the classroom. And at the time, which was last July, we did not have a full-time aide lined up yet. So we can say more about that later, but luckily we do have a full-time aide and she's great. But just sort of focusing on that transition. Andy, do you want to elaborate on some of your fears and our fears together?
Well, I think we take for granted the fact that all of us, as your kids going through whatever special needs school system you're going through, as was BOCES, and we knew that from 7:30 in the morning till 3:30 in the afternoon, you are, that's your time. A lot of people work. We have a farm, so I could work on the farm. Um, and it was you take this time for granted, and as soon as school is finished, that time's gone because you have to look after your child full time again. It's I found it quite hard actually, getting used to the fact that there was no external help. Initially when you come out of school, we, like Melissa says, we found a fantastic aide now that looks after Jaden, and she's become part of the family really. Um, I I think that, looking back on hindsight, what I would have done is I would have prepared a little earlier. Time really does fly quickly. You think that you've got, oh, it's only 2 years away before she finishes school, blah, blah, blah. It soon creeps up. And all of a sudden you're left there, holding the baby. It really is, it really does fly by. So any applications that you need to get in, start looking at places, residency, if it's schools, if it's aids, whatever you need to do, really do it early and don't let people sort of tell you that you're too much of a planner, Melissa. And because you really have to plan this thing early. The other thing I particularly found hard was when you're dealing with, as soon as your child becomes 18, um, in the eyes of the state, the federal government, whoever you're talking to, okay, they're an adult. And so you can't really speak for them. I've had people from Social Security and from Medicaid in the state wanting to speak to Jaden. Well, Jaden's nonverbal, she's in a wheelchair. And I've been absolutely livid. Why don't these people understand? you know, that you can't do this. Well, to them on paper, she's an adult. So really, you have to get everything in place. We went through the whole guardianship ritual, which actually was very smooth in the end, but it took a very long time to do. And you've got to get that in place, because if you're not the guardian, then you literally legally cannot speak for that person in the eyes of these people on a phone or on the internet. So that's something I really found hard to adjust to. I was assuming that they knew my child, but they don't. They're just a name or a number on the page, you know.
Thanks. Lori, can you share a little bit about your experience with Jacob along those lines?
Sure. So, the things that we are focusing on or have been focusing on was transitioning to adult medical providers. The hospital he goes to actually has in their charter that the day you turn 21, you can't be seen at the hospital anymore. And so for each specialist he has, we have to find a like adult specialist. So, I mean, he's overall pretty healthy, but he does have, the biggest thing would be a neurologist for his seizures. Obviously, a primary care physician that understands young adults with multiple disabilities, complex medical needs. But then, you know, he sees an endocrinologist, an orthopedic doctor because of all of the hardware that he's had in him and the spinal fusion and all of that. In the adult world, just so people know, you do not see an orthopedic doctor anymore. When you make an appointment, you only see a rehab doctor. And apparently it's very difficult if you need a surgery to have an orthopedic doctor agree to do a surgery on a child who has complex medical needs. I did not know that, but that's what our pediatric folks are telling us, which is very disheartening. But this is something that you've had since birth, you've had previous surgeries, and they don't really know how to approach that. So all of these different specialists that you might have seen just for, you know, minor things, you now need an adult provider. They may not all be in the same system like they were at your children's hospital. So that's a big thing that we had to approach and are still approaching. And the other thing is a suitable, like for us, we were looking at a day program, somewhere for Jacob to spend his days. And part of that is also the health reason, because when you're in a stander or a gait trainer or any of those sort of equipment things that you don't necessarily have at home, that's great for your digestion and your respiration and, you know, all of the different systems to make you strong and keep your bones strong and all of that. And, you know, I mean, we have a gait trainer here. How many times can you go around the kitchen island? You know, you want to be in a program where someone else is looking out for those things. And they also have the eye, a trained physical therapist, to say, hey, I don't really like the way he's walking on that left side. You know, you should get that foot looked at or something. So you're losing the medical eye and that school eye, or someone that looks at the wheelchair and says, hey, I needed to tighten something for you. And you're losing both of those at the same time. So because of that dual dynamic, you often hear people say it's like falling off of a cliff. You lose both things at once, and all of a sudden you're sitting there looking at your child saying, I'm trying, honey, I'm trying. I really want to do the best for you. But it's just so comprehensive what you need to do.
Thanks. So I've heard different ages that you've talked about here, you know, 18 and 21. So could you summarize, and it may vary, you know, by state or where people are in the world, but what are sort of those magic numbers in terms of, you know, losing access to specific services or schools, or the being treated as an adult in the eyes of the law? What are some of those ages that people should be preparing for?
Yeah, sure. Can I start?
Yeah, please.
From my experience, it was here in New York, was to once a child, i.e. under 18, has gotten New York Medicaid, for instance. Once she turns 18, you have to, by law, apply for Social Security, whether you want to or not. you have to go through SSI, otherwise you lose your Medicaid. So that happens at 18 years old. And then I believe the guardianship, Melissa, was it 21 or 18? I can't remember.
18.
It was that's right, it was 18. And that's when the problems really started. The fact that if you call your doctor's office, for instance, they want to physically speak to your daughter, even though she's 18. And it took some getting used to, and the doctor's office eventually understand this. But I will bang on about guardianship again. Guardianship really does open up a lot of doors and make things easier. So
it took a long time too.
Yeah,
and
it does take a
we
long time.
we were dealing with it during the pandemic, so the courts were backed up. So it took almost a year for us to get so she was like in this limbo stage up until she was almost 19 because the courts were backed up. So definitely start that process earlier, or as early as you can. Like I would start at 16, getting
No,
the paperwork in place.
we went the route of power of attorney. And instead of guardianship, and the same thing, people will say all the time when I take him even to urgent care, oh, well, he has to, where is he? He has to sign this. And I'm like, I'm power of attorney. And so if you go to a specific hospital or a specific doctor, bring it once, let them scan it. And then from now on, you just say, I'm power of attorney. And they look in their records and say, mom's power of attorney. It's a pretty hefty document, but just leave it in your car or something in case you need it, I'm sure. Same thing with guardianship, because you have to prove that you can make these decisions.
Thanks. And I know we've got folks here with us, so if anyone has questions, please feel free to come off mute and ask your questions. I'll ask one more to get us going while everyone else is thinking about their other questions. So I know both of you have different outcomes in terms of what your loved one has sort of done after schooling. Jacob's in a day program and Jaden is with an aide. So could you sort of talk through the decisions around going that direction for each of you? What made you choose the direction you went?
I'll start because Andy reminded me when he was talking earlier about our experience leading up to us getting a full-time aide when we're having difficulty finding someone. We looked at multiple daycare facilities and we just were not impressed by the quality of the physical facilities themselves, as well as like the ratio of caregivers to people, the adults who were there. One, for instance, we actually really liked it. It's a working farm, but she would have to have a full-time one-on-one aide in addition to that, right? So you get one or the other with the system.
Yeah.
So Andy, I'll let you elaborate on that because but that just reminded me of all the places that we visited that I had forgotten about.
Yeah, well, with Jaden, she's so really easy to look after. She's nonverbal. She sits in a wheelchair. And so it's very easy to put her in a corner or watch a TV. And when you've got three other handicapped people, and the places we went to, a lot of them were older people too. There was only a couple that were even close to being in their 20s. A lot of these were quite old people, and they needed a lot of care. So when you've got 3 or 4 people in one of these homes looking after, Jaden's the easy one. I just knew what was going to happen to her. For 3 or 4 hours a day, she'd be sat in a corner somewhere. And so when a wonderful miracle turned up, our aide, we decided that's the way to go. You do miss out on a lot of things. But our aide takes Jaden out. I can use the name, right, Amanda? She takes Jaden out. She uses our van. They go to the cinema. They go to the library. They get out in the community. Obviously, right now it's been pretty rough with this winter we've had. But I just feel so much more confident in the fact that she's being looked after all the time, rather than being in a facility where there are lots of other people.
Lori, can you share your experience?
So Jacob actually in Pennsylvania can go to school until he's 22. So he is still in his extremely wonderful comprehensive school. And they have a transition coordinator, and they will go and they will tell us about programs. They will go to programs with us. His teacher will go and they will tell us what they think of the different programs. One of the most powerful phrases I've heard throughout all discussions about transition is the term important to and important for. So what would be important to Jacob? What does he want his life to look like? You know, he may not be able to tell us in words, but we know him well enough. So what would make him happy and content? What would be important to him? And what's important for him? What would keep him healthy and safe as an adult? To the point that Andy was just making. So, you know, we're sort of at a crossroads, as it sounds like Melissa and Andy were. There are day programs to look at, not many meant for young adults. A lot of them are meant for seniors. Um, Only one I've heard of, and it's not in our state. Continue therapies, PT and OT. Is he just going to be parked in front of a television set all day? Because of his seizure disorder, there needs to be a nurse. If there's a nurse at the facility, that's enough for him. He doesn't need a one-on-one nurse. But if they don't have a nurse there, if they do have a nurse, they have a long waiting list, especially since the pandemic, because a lot of places closed. If they don't have a nurse and he has to bring his own, apparently that counts as an extra body to the state, and then they lose funding from the state for a person that they're watching. So places don't want somebody with a nurse, and frankly, he doesn't need a nurse standing by him all day long. He just needs someone to make sure, God forbid he has a seizure, there's somebody there. So it seems to be a challenge. The other part is to build your day piecemeal, and I'm loving what Melissa and Andy are doing. So now the wheels are turning. A lot of things that other people do are, you know, they'll find weekly events. So on Tuesday, there's music at the library, and on Thursday, there's something going on at the Y for people with special needs, and you just build a schedule piecemeal, and you bring your child, or someone like your wonderful aide brings your child. It's just not like school was. And so for that socialization, for that familiarity, you know, I would hope to find a day program, but they're not going to mirror school. So, you know, some kids are able to work. They have a program at school now run by CHOP where they volunteer with a volunteer. They take them up to CHOP, and Jacob has been there as a greeter with a switch where he says, "Welcome to Children's Hospital." And another volunteer helps him to volunteer. And that's a program that they have. You know, does he have the stamina to do it 4 hours every day? You know, after a half hour, he'd probably be like, no, all done, all done. I'm pretending to be asleep. So I don't know, but there's different things out there, but what is important to him and what is important for him, we're still figuring that out.
Those are two good phrases to hold on to as nuggets, I think, from this conversation. That's wonderful. So it's a question, two questions actually in the chat here. So I'm going to take these one at a time. So the first question is, did you observe changes in your child with the transition from school to adult services? So for example, more isolation, less socialization, impacts to mental health.
Yes. I found there's a difference, definitely. There just isn't the stimulation that you're going to get from a classroom that you're going to get at home. It's as simple as that. I think it's the way you combat it. I believe. I think we're doing an okay job. You know, laid on her bed last night, dragging out putting on some YouTube music videos. I had her giggling and laughing. You know, so I do think there's a difference. Yeah, and I think you've got to work through that personally. What do you think, Melissa?
Yeah, I think she gets depressed,
Yeah.
probably like any other adult, right? Like there's times when she's I think about when she was really small.
Cabin fever with the snow.
She was more willing to like reach out and grab things, right? She was more curious with her hands and her physical gestures, whereas now she's very closed in. She sits often with her arms crossed or tight to her, body, and is less likely to, she has days. Amanda was telling us earlier, that she'll grab paints or whatever, but some days she is more reserved. So.
Lori, any observations?
I mean, Jacob's still in his daily program, but one suggestion is I've gotten really involved in his school, and the more involved I get, the more I advocate for programs with alumni. Totally self-serving, but everything we do, I say, we should invite alumni to this. And I started a family chat, theoretically like a support group, but we had done it at our old school. And it's just, no agenda, just parents talking. And we invite alumni and we get a lot of information from them because they're the ones that know transition. People with younger kids may not have as much to say during, those conversations, but we involve them. And then every time there's the summer picnic, and we're like, don't forget to invite alumni. So can alumni come for this event? And so, I'm just trying to preemptively make more and more occasions for alumni to be, so that Jacob can be around these familiar people and doing these fun activities that his school does. So I just keep bringing up alumni.
Can I just
And I'm
add
even
one
thinking
more thing?
like, I should start
Sorry.
volunteering at the school so that on the days that I volunteer, I can just say, I'm bringing Jacob with me. Every, twice per month, I volunteer in the art room. And now Jacob comes with me because he lives at home and we volunteer at the art room. I'm just thinking of any way that I can to get Jacob back into that atmosphere that he loves, where he comes alive the most. So I'm trying to kind of backdoor it.
Creative advocacy.
The other thing while I'm talking about that, is Jacob's Hospital, I think I told you, has that policy where the day you turn 21, it's actually, the hospital was owned by, or started by Alfred I. DuPont of the DuPont family. He wanted to start a hospital for children, and he wrote in the charter, this is a children's hospital. The children stops getting seen at the day they're 21. So the board is very finicky about, it's in the charter, that's how it's funded by, by his will or whatever. Jacob it was right before his 21st birthday. He had a bad series of seizures and he was inpatient. And we were going to be getting out before his birthday, but I asked I knew the president because I'm involved at the hospital. And I said, Jacob is in crisis and I can't have him changing to adult doctors right now. Is there any way that he can change? I need him to have continuity of care. And there's those buzzwords that you use with the medical field: continuity of care, medical home. This is his medical home. He needs continuity of care to see him through this. Can he still be seen here? And he sent it to the chief medical officer and they granted him a 4-month extension. You can see people here, including the ER, et cetera. When he just had this RSV, I wondered, should I take him to an adult hospital or should I take him back here and sort of take advantage of this? He was intubated when that 4 months expired. And the chief medical officer sent me a note and said, I don't want you to worry. We are extending this until his 22nd birthday. So the moral of the story is, don't be afraid to ask. This Nemours does not grant exceptions, except they do grant exceptions. So ask for something. Schools get funded by the state and whatnot, but can you come to this event? Or in a medical facility, can you be seen by this specialist just one more time.
Thanks. So another question, did you experience changes with health insurance coverage, medical equipment, supplies, and supports?
You want me to go?
Yeah, go for it, Andy.
Yes, you're the
Um,
paper guy.
I found that I found it quite difficult at times whereas schools, you need all sorts of things. Sorry, to get things like wheelchairs, even diapers, for instance, incontinence supplies. You have to get notes from a PT and it's easy to do with the school. Once you're out the school system, that's much harder to find and to do. Um, the one thing I did find is there is a loophole system in the state of New York, and I believe it happens in a lot of other states too. I'm pretty sure it does. Is the fact that what is your primary health insurance? Is it Medicaid or is it your family insurance through work or whatever? When you start using them both, one's primary, one's secondary, okay, you get the runaround from a lot of people. Oh, we don't accept that because of that, and we can't, you need a waiver for that before that. I found that the easiest thing to do is to turn around and say, no, we are not paying for our daughter's insurance. We've got Medicaid, so Medicaid is the primary insurance. That then takes care of a lot of these situations. Now, I know there are rules in place. If you've got other health insurance, you have to declare it, et cetera, et cetera. But things become a lot easier when you make the decision, as we did, that, or, you know, through whatever reason, Melissa knows more about it than I do, but when you just have Medicaid, things become so much easier.
Yeah, we took her off of our family plan because we kept getting, otherwise they were bouncing between one another for approval. So Medicaid would say, oh, she's on another plan. We have to go there first and get denials
Yeah.
before they would pay for it. And so eventually, I think it was actually one of our medical practitioners who said, you really should take her off your plan because this is, and then Medicaid will just cover it straight away.
Was that before 21 or after?
It was kind of, it overlapped over the two.
Yeah.
It really did.
It was definitely after 18.
Yes.
But I can't remember what year she got on the SSI.
Yeah. Well, we were trying to, and
That
it
was-
was when she was still in school, we were trying to get repairs on a wheelchair. One of the arms fell off. And we weren't allowed a new wheelchair. So to get these repairs done, we had to get a refusal from this and this and this. And
Right.
then we got a bill off one company, like changing a screw for about $500. And it wasn't covered by insurance. And we ended up paying for it because we got denied by this insurance. It's a complete mess. So my advice really is if you can do it, get onto your state's Medicaid and then don't put your child on your own insurance. Okay, if you really can, that's much easier.
Thanks. If we could go back to the guardianship and power of attorney conversation. Lori, was guardianship ever something you considered for Ben, or what made you go the power of attorney direction instead?
There were just conversations from people from our old school who were very anti-guardianship, saying, and I don't know why you would want to go back from it, but once you're a guardian, you really can't unguardian. And just a lot of conversations. And if you can be power of attorney, you can always get more. You can always go to guardianship, but you can't come back from guardianship. And it works kind of the same way in that you're being responsible for them. But if you can do power of attorney, just do it that way. And we talked to an attorney, and she said, we were doing our wills, we were doing things with my mom, and she said, let's just do power of attorney because it's expensive to do guardianship. It takes a really long time. And I don't know if it's state by state, but in Pennsylvania, judges do not like to grant guardianship. They consider it to be very restrictive for the individual. And in Delaware, where we used to live, and in Pennsylvania, it's very hard to get granted guardianship because you're theoretically taking away this person's rights, is the conversation that they were having, and saying, I'm totally responsible and this person is not responsible for themselves. So they said, if you can do power of attorney, that's why judges don't like to grant it. And you really have to prove a lot of things. So we just did power of attorney.
Listen, Andy, do you have some more details to share about your guardianship journey and sort of how long it took and why you chose to go that route?
Well, Melissa did all the paperwork, but for us, it wasn't. I think it just came naturally. The fact that Jaden really cannot make decisions for herself. We are completely. She's completely reliant upon us. So there was never any issue of that. It's and she's always going to stay with us.
Yeah, it may be, I think for some people who have options or aspire for their child to live in a group home or, something different than their home, home with the parents, it might be better,
Yeah.
to have one or the other. But I think for us in our mind, that's not something that we would do as long as we're alive, because we call ourselves the 3 empty nesters, right? We can't stand to be away from her. So, that's why we pursued guardianship. It took longer for one, because it was during the pandemic. So the courts were backed up. I remember when we got the court date, it was like 9 months out. I remember opening the mail and saying, "Oh my gosh, it's 9 months away." And so it's just being prepared. Some people use a lawyer. We filled out all the paperwork ourselves. We did not feel the need to use a lawyer. The court hearing was really simple, and the judge was very empathetic and kind to us. I remember him saying,
Thank you. Yeah.
"Thank you" to us for being good parents and taking care of our child. It was just like, oh, wow. And but it was literally like 5 minutes online. It was online. It was virtual because, again, during the pandemic. So
Well, we did
that
go
part was
through
quick. It was all the build up to it that took so long for that 5-minute meeting.
I think we went through, who was that lady we went through?
Oh yeah, there was an intermediary
She's like a lawyer.
office who helped us, that our case manager recommended to us, but she basically just looked over the forms that we completed.
So I wonder if that really does change state by state, because at the time they were saying, I mean, it was really, really hard to get guardianship here. And that if it was going to do the same thing for you, that, and we had procrastinated a lot, so we needed something that would happen soon.
I think the states
sorry.
I was just going to say, I think that some are more proactive in what they recommend. And New York State is a state that spends a lot of time promoting in-home care to try to encourage families who can keep their family members at home. And they are willing to invest in home modifications and other things like that, because our facilities and group homes are already, the wait lists are too long.
Yeah. I can't remember what I was going to say now.
Sorry.
It'll bubble back up.
Yeah, probably.
Other questions from the group here? You're welcome to come off mute or put something in the chat.
Can you hear me?
Yeah. Hi, Nicole.
Hi.
I apologize. I missed the first 10 minutes as I was coming back from a work thing. And so I missed the introductions. But Lori, it sounds like we're close. My daughter's also seen at CHOP.
Okay.
So we're 15 minutes from CHOP.
Okay.
And my daughter is 17. She'll be 18 in September. So I was actually shocked to hear about guardianship. We have some friends going through it, and it seems like they've had a pretty easy time. So I don't know if I don't know if it's like county to county court or what, but I'm hoping we don't have that issue because we we do have the legal paperwork in place. Um, but I think we would want to go guardianship, like Melissa said. Like I don't foresee Dominique ever being able to make decisions for herself. I mean, she's nonverbal. Like, I don't see it.
Well,
But so as we're approaching 18, we have our caseworkers in place and all of that. And I've always tried to like stay on top of it. But, since all of our friends are about the same age and some are going through it, and they've all said, no matter how much you stay on top of it, you still get smacked in the face because it's just so much. But so yes, we can stay in the system until 22, which we will absolutely do. But I know there's stuff with 18 too. So I just want to make sure we've been in close conversations with our case manager as we're approaching that. But I guess, is there anything, were you in Pennsylvania? I heard you say you were in Delaware too. Were you in Pennsylvania when you
no, at the time we were in Delaware for a while and then we moved back to Pennsylvania. So it was Delaware where they were really strongly adamant to um, not go for power of attorney. I mean, to not go for guardianship. I'm sorry.
Okay.
And so we had started down the path of power of attorney, and then we moved to Pennsylvania. So we just continued with power of attorney.
Okay. And I can see how that could make sense. In some cases, I feel like
I mean,
that's
Jacob's going to live here forever. I sleep next to him every single night for my whole life. Like, he's not going anywhere.
yeah.
But we had started that because of how it was in Delaware. So
Okay. Okay. Yeah, we're in the same boat. 3 empty nesters.
yeah, I like that.
Yeah.
Where does Dominique go to school?
So she's in our local public school. We are at Strathaven, Wallingford Swafford School District.
Yeah, we're in Garden Valley.
Oh, neighbors.
Yes, neighbors.
Yeah, so we've always been seen at CHOP. Well, our developmental pediatricians at DuPont, but we've been asking all of our doctors, how long will you keep us? Neurogenetics is obviously the most important, and he will keep us till 21. And ironically, adolescent med will keep us till 24. That kind of shocked me, but everybody else was like, yeah, we'll see you at 18, which is like dermatology. It was no,
Right. So what I would suggest, and I was going to bring this up anyway, is for your medical transition, take the doctor that is most important to you and your primary doctor and switch those early, because like we switched neurology to Jeff, and because that's the doctor that you don't want to get caught with your pants down. You don't want to get caught with someone that you don't like. So change that one early. And then if you don't like them, you still, like, I didn't stop seeing my doctor, my pediatric doctor. I just made an appointment with an adult provider, and I liked the adult provider. So then I kind of told my pediatric I had switched. If I
Okay, so
didn't like that one and there was an emergency, I could still have gone to the pediatric one.
okay.
And then for your primary care, that's one that's going to be your air traffic controller, right? I mean, that's what your pediatric doctor's supposed to be. I mean,
Yeah.
I'm sorry, your primary care doctor's supposed to be. So you might want to switch them a little early too, because they'll be the one giving you recommendations for other doctors. The other thing we did was at the appointment, like a year before, we asked everybody for recommendations for the adult world. And then within 6 months, because some doctors it takes a long time to get into, so that we could start looking into it. And then within the last 6 months before Jacob turned 21, we made an appointment with every one of his specialists so that we could ask them for, any paperwork, any recommendations, what should I be looking out for? What should I tell his doctor? And then we asked again, well, what's your recommendation for who we should move to make sure it was the same person, or we asked about the person they had told us before. And that way we know that he'd been seen. And so I didn't need to rush to endocrinology, because that's just sort of a check the box once per year kind of thing.
Okay, that makes sense. Yeah, specialist wise, it's really just our developmental ped is at DuPont, but and we adore her, but our neurogenetics doctor at CHOP, all the other specialists, we've been through like a ton of specialists, but the only one that, we're really strongly followed by is neurogenetics. And I don't know yet, but I would probably go to somebody at Penn because they're so close and
Right.
working together with research.
Yeah. For you, they'll be able to talk to each other.
Yeah.
And I'll, we can have a sidebar at some point, but I'll tell
Yeah, I
you
know. I'm taking up everybody's time.
who you want to go to for your primary care. The person we ended up to, I will just say, I left the office and I said, that was like a warm hug. And I didn't expect that in the
Here, yeah, I'll take recommendations. You're very
transition world.
We are lucky that our whole family sees the same family nurse practitioner.
Oh, that's
We didn't have
great.
to worry about changing her over from a pediatrics
That's great.
general practitioner to adult. But we do, she had the spinal fusion 10 years ago this year. So we will have, and she had that done at Duke University by a pediatric surgeon. So we'll have to find someone up here in New York for her, because they told us that 10 years she should have it reevaluated, probably have an updated x-ray or whatever to see how things are in alignment.
Yeah, Jacob's spinal fusion is starting to
Oh, really?
move. Yeah,
Yeah.
we get it x-rayed every year,
Oh,
and
wow.
it's starting to
Hmm.
and they said it's just the nature of the beast.
Yeah, Jaden's we haven't noticed it in her back, but she does have like a little bit of a hump at the top of her neck, which is probably where it's fused at the top.
I didn't notice it in his back, but I noticed it in one shoulder starting to be up a little bit more than the other.
Yeah, the kyphosis.
His was 10 years ago. His was in 2015.
It was not a very nice experience, but her health is so much better because of it.
Mhm.
It really is.
Okay. Another question in the chat. So thinking even longer term, as part of your planning, have you also planned for what would happen if your child outlives you?
If our child, what?
Outlives you.
That's the hardest for me.
Mhm.
That's the one big worry I carry around with me all the time. Like, my brother and his wife live in North Carolina. They have 2 children. But just the fact that they live in a different state, right, makes it difficult because it wouldn't be beneficial for her to leave the state of New York when she's all set up for her with Medicaid and the care here. So I'm not sure yet.
It's a heavy question.
It is.
Yeah.
It is. Yeah. And it's one we've procrastinated on, to be honest with you.
Yeah.
And then I know I've been on panels, even with BOS, that talks about putting burdens on siblings. Like Jacob has 17-year-old twin sisters. Do you tell a 21-year-old, 23-year-old, child, okay, now your brother is your responsibility. He has to live with you, or do you get the kind of guardian for him that watches him in a place and they have to visit him 3 times per week as stipulated in some document? Or do I ask my 60 whatever year old sister she would be then to watch him? It really does. It keeps you up
Yeah.
all the time.
And we do have, we are doing a webinar on Thursday, March 6th about special needs trusts, which I think is a related conversation. So that might be of interest to some folks as well.
Well, we'll definitely be on that.
Yeah.
That was the first document we did. I don't even know how long ago.
Wow.
Great. And I think we've got just a couple of minutes left here. I was just going to ask, sort of, as you think back on where you've been and where you are now, what are some of the additional resources, either types of people or other organizations that have been helpful to you in getting your game plan together, supporting you? What would you put on a list of sort of recommendations for other folks to look at in terms of supportive resources or information that might be helpful to others?
Parents, other parents.
That's true. Learning from other people's experiences are really helpful.
Great.
I think like Andy was saying before, I mean, it varies a lot by state when you're talking about resources themselves. I would say most states, I believe, have the Parent Information Center, a PIC.
Hmm.
So that's a good place. Or they have many have like a parent to parent program, to look those up.
One thing we've done with our aid, and you tend to take this for granted when you're living in urban areas because there's so much to do. Okay, but when you live out in the boonies like we do, they're really, especially this time of the year. In the summer, it's not so bad. But we sat down and worked out where can the aid and the van and Jaden go during the day, places to visit, and you'll be surprised what you come up with.
Hmm.
You know, she's taken her to apple orchards, strawberry fields, you know, the movie cinema, libraries, nature reserve areas. You know, there is massive resources out there. And particularly if you're in places like Philadelphia, oh my God, how many museums is there to go to, you know? But there's a ton of things out there. Sit down and put a list out and really plan it in, you know, right, we're going to go here, there, we're going to do that, you know. There is so much out there to do that really, you know, there's lots to do. That's all I would say, and just plan for that.
So any final thoughts as we wrap up here?
Go Bills.
Go Bills. Yes.
Go Eagles.
Yeah.
EAGLES, Eagles. I mean, it's hard, but you just sort of have to have your list of things to do and celebrate each thing that you cross off the list. And don't beat yourself up if you miss something. Jacob's 21. I think at 18, I was supposed to get him an ID card, some sort of ID card. Yes, I have to get to that. I mean, there's going to be things that you have to do. There's going to be things that you do early, like his special needs trust, but he doesn't have an ID card, and you can't beat yourself up because there's a lot of things on that things to do list. So just when you hear something at something like this, just, jot down all the things you have to do, make the calls to someone or look it up, Google it, get the paperwork, but you'll get it done. It just takes a while.
Can I ask one more question? What about in terms of the transition for yourself, right? So if you think about maybe other peers you have are planning for their retirement as empty nesters and what they're doing, how has this transition impacted your plans, and how do you still ensure that you're finding joy in this next chapter in your lives?
Oh, you're not going to make me go first, are you?
Go ahead. You spoke first.
It hasn't changed much for me, to be honest with you. I know Melissa and I have talked about things we're going to do. We want to go and travel in an RV with Jaden, and do that kind of stuff. You just got to,
Keep
I
dreaming,
I
right?
really
Like,
don't think change
don't be
much.
afraid to dream up the wildest things.
Yeah. We took Jaden to England for Christmas 2 years ago, and it happened to be my mother was there, and my mother passed away about a month later, and it was the last time we saw her, and a whole family was together, and it was a pain in the backside to get her there. It really was. It was a travel nightmare, but we did it, and I'm so glad what we did. You know, it's a really great memory to have. You know.
But we really want to get an RV and go see Amanda and Laura.
Yeah, on the Maine. That's right. That's right. Wonderful. Well, thank you everybody for being here, and to Melissa and Andy and Lori, thank you so much for sharing your wisdom and what you've learned and your experiences. Really appreciate it.
And if you could give Nicole my email address.
Yes,
so I
absolutely.
can
I'll connect you both
share
by
some
email after
local
this.
resources, that would be great.
Yes, thank you. I appreciate that.
Yeah, of course. All right. Thank you, everybody. Have a great day.
Thanks.
Thanks.
Everybody.
Bye.
Thank you.